So functional medicine looks at things a little bit different, based around those core dysfunctions, what's going on. Rather than just focusing on your symptoms, we like to look upstream, and look at how and why that illness or those set of symptoms have occurred. And it's very individualized. You know, as I said, in those group of people with a diagnosis of obesity, they're not all going to have those same imbalances at play. How do we do that? We use all our knowledge of biology, genetics, epigenetics to look at the factors. So I don't know, again, if genetics and epigenetics is a strange term that maybe not have explained to you, but for anyone in the audience who isn't sure, genetics is your DNA. So these are the instructions, in effect, that you received from your mom and your dad in every cell of your body, and they received from their parents. Now, up until a few decades or a decade ago, we believed that your DNA was written in stone, that whatever genes were there, they were going to be inactivated, and you were going to develop whatever risks those genes were associated with. And so it kind of made that we had a good few years where people were like, what's the point? I've got bad genes. There's just nothing I can do. And unfortunately, it really made a lot of people feel very helpless about their role in their health. Then came the field of epigenetics. That's where we realized, based on what we expose ourselves to, that is what tells our body which instructions to follow, which ones to ignore. So all the time, there's this discussion between our environment and our genes. So genes are being switched off and on based on what we're exposed to. And it gives us a lot more sense of control, I believe, for what we can do for ourselves and our health. Core to the practice of functional medicine is that you are the center of this. This isn't about the fact that I've got 5 minutes, just get to the point because I've got the next guy outside. This is about you, and we need to understand your whole health journey, even from preconception. Was your mother in an abusive setting? Did the pregnancy take place where she was under duress? Were you exposed to more stress hormones in the womb than someone who was in a normal, calm household? Through to where you are now and all of the conditions that you're struggling with, the symptoms that you're struggling with. So we think about all of that. It's difficult to do that as, in a GP surgery. They don't have time, and this is something where we realize we need to give it time to be able to do someone justice and to really unpack what might be going on. So this is the rest of the tree. I don't want you to worry about the details. But in essence, this is where we're working at the moment. A lot of the treatments, if I use inflammation as an example, inflammation, the other way to think about it is almost as if your body's a home and someone said, there's something bad going on, I need to call for help. So they go out to the flagpole and they put up the flag to the top of the flagpole. A lot of times our current treatment regimes really just involve suppressing that signal. So someone goes along and saws the flagpole off, and off it goes. Is there inflammation still going on inside of that household? Yes, but what you've done is you've suppressed the actual signal. The signal, yes, it's causing you, that headache or that achy joint. But the problem is did you actually find out what caused that fire, what caused that inflammation to begin? So that's where we're working at the moment with medicine, really. And this is what actually underlies the symptoms. And this is all of the lifestyle interventions, the roots of the tree that are feeding up. So just in essence, this is what you feel. This is where I work to figure out what's happening. And this is where we go forward when we plan an intervention with functional medicine.